Okay, well, good evening. My name is Jim McClelland, and I work in the county's Office of Emergency Management and Homeland Security. On behalf of the age-friendly Montgomery Senior Safety Work Group, I want to welcome you to this evening's live town hall. During the next hour, we're going to be hearing from a number of experts who will offer recommendations and resources on how seniors, as well as their families, friends, and caregivers, can remain safe, with a particular focus on the pandemic and the challenges that it presents. We've got a packed agenda, so to keep the program moving, we're going to be muting all the attendees. We also want to let you know that we are recording this evening's presentation. Questions may be submitted via the chat feature in Zoom by clicking on the chat icon at the bottom of your screen. We will address as many of the questions as possible during the Q&A session at the end. So without further ado, let's begin with Jim Resnick from Montgomery County Fire and Rescue Service.
Thank you, Jim. And thank you to all who joined us and those who hopefully are coming in a little while. On behalf of Fire Chief Scott Goldstein from the Montgomery County Fire Service and the more than 2,000 combined career and volunteer members of the Montgomery County Fire and Rescue Service, thank you for joining us this evening. Montgomery County Fire Rescue Service is an all hazards department, meaning we not only respond to fires, but also emergency medical services or EMS calls, technical rescue calls, and more. Jim, can we go to the first slide, please? I'm going to be speaking with you all this evening briefly about fires first and then emergency medical services. Since the beginning of the pandemic, we've noted a spike in residential fires, a spike in fires involving homes with seniors, and a spike in the number of fires with no working smoke alarms. Also, a spike in the number of fires involving serious injuries or deaths. That's the sound that you should hear when you push the test button on the smoke alarms. Next slide, please. Have a plan for fires and other emergencies. The first and most important lesson is to get out and stay out. Get outside and call 911. Get out and stay out, and if you cannot get out, then get to a safe location behind a closed door and then call 911. Have that plan, practice that plan, make sure that everyone in your household knows what to do in the event of a fire. And again, since we're talking fire safety for seniors and for people who take care of seniors, remember that's often going to take a little bit longer to get these folks out. So have that plan, practice that plan, know that your smoke alarms are working, okay? Next slide, please. When it comes to emergency medical services, COVID has strained some of our resources. COVID has changed some of what we do, but we are still there for you and your loved ones should you still call 911 for an emergency. So in an emergency, don't delay, call 911 early in the event of a medical or other type of emergency. I'll repeat, if there's a medical emergency, don't delay, call 911. The 911 call taker will ask the normal questions, including the location of the emergency, what is happening, and your name and phone number. They will then dispatch the closest appropriate units. As soon as the units are being dispatched, the 911 call taker will stay on the phone with you and ask a few more COVID-related questions, including, does anyone in the home have a fever? Or has anyone in the home had a positive COVID test? The answers to these questions will only change the way that the EMS crews will protect themselves and you. Otherwise, it's business as usual. We're going to respond. We're going to take care of the ill or injured person, and as necessary, we'll take them to the hospital. We will treat and transport the person as usual, but keep in mind we might be limited in where we can take the patient depending on hospital bed availability. Next slide, please, Jim. Keep in mind that family members will not be able to ride in the ambulance, and there might be restrictions about whether family can come into the hospital. That is why a file of life is so important. The file of life form that you can see that's attached to the refrigerator here, and the magnet that lets you hold the form or place the form on a refrigerator, can be easily obtained. You can go to www.mcfrs.org/mcsafe and print out your own form, and then fill it out and place it on the outside of your refrigerator. If you look at that picture, you can see that one of the forms is actually in a Ziploc bag, which is attached to the front of the refrigerator with a regular magnet. In the lower right-hand corner of that slide, you can see that website that I mentioned, www.mcfrs.org/mcsafe. You can also call 311 and request that a file of life form be sent to you. Finally, next slide, please. Actually, go back one if you could. Sorry about that. Finally, the fire department's lessons from COVID-19. First of all, just like the rest of the community, we in the fire and rescue service need to practice prevention, COVID prevention, both while on duty and off duty. This includes wearing masks properly all the time, practicing social distancing and limiting social interactions, and also remembering the benefits of frequent hand washing. Second, most of our previous cleaning protocols that we were already using on ambulances, in the fire stations, with our equipment and so on, those protocols were very, very good. So it hasn't been too difficult for us to modify a little bit and upgrade our procedures. The third lesson that we've learned during the pandemic is that fires, collisions, and other emergencies all occurred before this pandemic. They've all occurred during this pandemic, and they're going to continue to occur when this pandemic ends. Preparedness and vigilance will always be necessary. So we beg of the public, do what you can do on your own, but contact the Montgomery County Fire Rescue Service for guidance or assistance as needed. You can call 311 or go to www.mcfrs.org/mcsafe for more information. Now I'm pleased to pass the microphone to Captain Stacy Flynn with the Montgomery County Police Department.
Hello and good evening, everybody. I'm going to be talking with you tonight on behalf of Chief Marcus Jones, and I currently work in the police department in our community engagement division as the director. Thank you, Jim. That was some great points, and I'm going to sort of, pivot off of a little bit of some of the things you were saying as well. I'm going to be talking to you guys tonight about personal safety, especially for seniors. I think it's really important to understand that crime is currently up. Unfortunately, I think that there is a correlation with the COVID event. I believe that essentially people are kind of restless and just kind of trying to get out there and get back into the swing of things, if you will. And that goes for all of us trying to get to the grocery store, as well as, unfortunately, criminals trying to sort of get what they can out of society. Specifically, what I want to address is the importance of understanding that, especially with seniors, but pretty much with everybody who could be the victim of a crime, that there's essentially two types of victims, if you will. A victim can be targeted specifically because of an opportunity, or they can be targeted because of profit. And I think Tracy is going to talk a little bit about senior fraud, so I'm going to concentrate on the opportunity crimes as well as just senior safety in general. When we talk about crimes of opportunity, that's the sort of thing where we're having a lot of a huge uptick in people leaving their cars running, especially when it's cold outside and you want to try to warm up your car before you get in and go to work or go to the store or go visit family. And unfortunately, the crime of opportunity is that criminals are kind of walking throughout society and they're walking past your home and they look over and there's a beautiful car, shiny and new, running in the driveway with keys in it. Doors are unlocked. And they jump in and they take off. And we've had a huge uptick of these types of crimes, kind of grab and go. People do it a lot of the times outside of a convenience store, outside their home, and it really is a convenience. So I'm going to ask that if anyone should want to warm up their car, to either have a self-start feature or just get your key fob so you can at least lock your door. So if your car is warming up, then you have a key fob and you don't have to worry about someone just jumping in and taking off with your car. It's also occurring at gas stations. And a lot of these crimes are unfortunately turning into violent carjackings. And the reason they're turning into violent carjackings is because the owner of the car, you know, it's a pizza delivery person or what have you, they're coming out of wherever they were, they're seeing some stranger in their car and they're trying to prevent the stranger from stealing their car. The stranger just wants to get the car and get away. Their intention is not to harm somebody. That's not why they're, you know, going out and trying to steal a car. They just want a nice car. So when the owner of the car is trying to stop them, then they're getting into a violent confrontation, which elevates it from being a simple car theft to being a violent carjacking. And people are getting hurt because they're trying to fight back. So when we talk about crimes of opportunity, the best tip that I can offer for people is to please not leave your car running. And by the same token, we have a lot of cases where when somebody goes grocery shopping, for instance, we might have a tendency, I know I've been guilty of this in the past, of leaving our purse in a shopping cart and just kind of turning our back for a moment as we're looking up on a shelf or trying to make a selection. And again, thieves are walking through the grocery store and they're looking for these crimes of opportunity where our purse might be unattended or where our purse is hanging over a chair at a restaurant, those sorts of things. And a lot of the times they'll just reach in and snag the wallet. So when you turn back around, your purse is still there, but it's not until you get to the checkout aisle that you realize your wallet is gone. And what the thieves tend to do is they tend to immediately go out and start shopping and spending thousands of dollars on your credit card. A lot of the times they're going to be buying gift cards or large ticket items at big box stores. And they want to try to get as much as they can before you discover your card has been stolen and you call your credit card company to cancel the card. So we're asking people to please just kind of look around and be vigilant when they have the opportunity if they're setting their purse down. Another thing is when we talk about is just looking around and being aware of your surroundings. So we like to call it kind of your head is on a swivel. So if you get out of your car and you're walking into a building, just kind of be looking around before you get out of your car or before you come out of a building, just to kind of notice, is someone just standing around for no reason? And if you see someone standing around, it doesn't necessarily mean they're a criminal, but it might not be a bad idea to kind of ask yourself, like, well, are they waiting for somebody? You know, just try to process in your mind, you know, trust your instincts. And if you think that somebody's, you know, maybe waiting around to do something nefarious, either wait until somebody can escort you, either to or from a building, wait until they've moved on, or you can always contact the police if you think that they are suspicious, and we're happy to come out and at least check them out. We're going to ask that folks park in well-lit areas. To remember where you park your car, you can sometimes take a picture, and to always, always, always lock your doors. The other big uptick that we're having is cars are being broken into in the driveway of people's homes. And a lot of times people will leave not just their car key in the car, but they might leave their garage door opener or the key to a different car in the driveway. And so thieves are not, you know, unintelligent, and they're getting into the open car and they're, yes, stealing cash or things that are easy to just pick up and carry away, but they're also actually being a little more bold, and they're coming into houses to grab purses and cameras and things of value we tend to leave kind of by our garage door. So we are getting reports of, not too many, but we do get an occasional report of where a person that's just trying to steal something out of your car is going to then use your garage door opener to come into your home and get a little bit more than just stuff in a car. So we just ask, please, please, please lock your doors. If we could go to the next slide. If somebody is targeted, we ask that you not confront or fight the person. If they're trying to take your things, just give them your things. Nobody's life is worth a car, a wallet, and anything. I can't think of anything where, you know, somebody's life is on the line. And again, the thieves are not necessarily trying to hurt the person they're stealing from. They just want to get free stuff. And if you put up a fight, they're gonna fight you. If you try to hold onto your purse, they're gonna pull it away. Or same thing with your car. Unfortunately, earlier this year, we had a woman who was beaten pretty badly because she was at a gas station, and the guy jumped in her car that was running, and he tried to take off, and she tried to stop him, and he got out of the car and he became violent with her, not because he was intending to hurt her, but he just wanted to steal the car and she didn't want to let it go. So we just really ask, just give it to them. It's just not worth it. And always call 911 as soon as practical after something like this should happen, or if you witness something like this happening, we ask that you give us a call, 911. And pivoting off of what Jim was talking about, usually there's a series of protocol questions that the 911 dispatcher will ask you. They're going to ask you for the address. They're going to ask you to repeat the address. They're going to ask you for your name and phone number. And then they're going to say, tell me exactly what happened. So just kind of in the back of your mind, if you ever need to call 911, those are the series of questions that they're going to ask that are standard protocol questions. And if we can go to the next slide. Thank you. If anyone has any questions that they'd like to ask, I am happy to answer them. And that concludes my presentation. If nobody does have questions, and I will pause a minute to breathe momentarily, but if nobody does have questions, we have next up is Tracy Rizvani with the Office of Consumer Protection. So I will just end with, does anybody have any questions in the chat that I can answer?
I do.
Yes, sir.
Just to add to your thing, my elderly mother was at Trader Joe's, and a man with a Hawaiian shirt, which looks like a Trader Joe's employee, asked if he could help her. And while they were talking and he was quote unquote helping her, his accomplice took the wallet out of her purse, which was sitting in the little cradle where you put kids. And she didn't even know until she got home.
Yeah.
Like probably an hour later, maybe even more. So, yeah, I think that was really slick is all I can say, but yeah, you got to watch out for that. That's all.
That's a great point, because these criminals are not stupid. And, you know, I'm sure that they probably went out and spent some money on her credit card, you know, kind of before she even had a chance to realize it. And it's sad, but one of the things that we are seeing is that these types of criminals are really targeting the elderly population. And one of the reasons for that is that people who are older tend to have been working hard their entire life, and they have nice things worth stealing. And that's what we talk about, you know, crime of opportunity or crime of profit. That's sort of typically their motivation. But I'm very sorry what happened to your mom.
And I've actually told women who have open pocketbooks in that scenario that story, and they're like, oh wow, thanks. And I think they become more aware, because that is so easy if you keep your pocketbook up there. You know, at least put it down at the bottom of the cart and maybe put some groceries on top of it, you know. Exactly. A little harder to grab.
Yep.
Hey, as a reminder to all participants in this, we are recording this event. Thank you.
Well, that's all I have. Thank you very much.
All right, hello. I'm coming from the Office of Consumer Protection. It's one of the few county-level consumer protection agencies in the area. And ordinarily, folks can reach us by phone, but during the pandemic, our front office is closed. So if folks have questions, email us and we will be able to give you a call back. Next slide. So just briefly, what we do for folks, the services we provide in the county, we handle disputes between merchants and consumers. With some exceptions, limited exceptions, if you've paid money and are not happy with the outcome or with the good or the service, you can file a complaint with our office and we can look into it, investigate the facts, look at the law, and see if we can resolve the dispute. We can also field inquiries. If you're not sure this is something that's worthy of a complaint, you can definitely email us. We'll call you, we'll speak with you about it. Ordinarily, before the pandemic, we could do walk-ins with no appointments, phone calls with no appointments, and hopefully we will be able to get back to that soon. So we ordinarily could do the consumer specialist by phone, in person, or now by email. If in the process of investigating the complaint, we find that the law has been violated, we do have, as a member of public law enforcement, the ability to bring enforcement action as well. We also do get invited to do programs by community groups, neighborhood groups, business groups, etc. So if you would like to have us come and speak to your group, by all means invite us. We also do license and regulate certain businesses in the county. If you're getting your car repaired, hopefully they have our certificate on the wall. If they're coming into your home to repair your TV or your refrigerator or any kind of appliance, they should be registered with our office. New home builders we license, as well as tow companies and secondhand personal property dealers, which we license as a service for the county's police department. Next slide, please. So this is a real brief overview of the kinds of COVID-specific scams that we have seen. We last month warned everybody to be aware that now the vaccines are out there, you may end up getting fake sign-up requests by email, by phone even, and by texts. So folks are filling out forms everywhere trying to get into a vaccine, and this is making it very easy for the criminals to slide in and get you to fill out forms that provide your date of birth, your insurance information, maybe some credit card information. The vaccines are free, and you should not have to pay for any of it. And if anyone says pay to get further in line, to hold your place in line, that is a surefire sign that this is a scam. So if you get any kind of emails and you're not sure if this is legitimate, feel free to forward it to us. You can even forward it to Health and Human Services, who will be up next, and in two agencies down. And we are happy to vet it for you if for any reason you think that this is an issue. A good rule of thumb is they tell you to wash your hands for 20 seconds. Give that email, text, or phone call 20 seconds and really think about, is this legitimate? When it comes to seniors, in just June of 2020, Hetherington Group reported that for New York and New Jersey alone, about 100 seniors ended up losing about $1 million to the grandparent scam. Ordinarily, the grandparent scam is someone calls crying or threatening a grandchild or pretending to be the crying grandchild, and they're in jail in Mexico or in some, godforsaken hospital and God knows where, and they need money. Now, obviously, the twist is I'm in jail and everybody has COVID, or I'm in this hospital and they don't have room for me and everybody's sick. You got to send money. So our director has a good expression. He says, you know what, these scams mutate faster than any virus could. And this is a sign of how the grandparent scam has mutated. When the first stimulus bill came, 180,000 fake websites popped up trying to steal that money and getting you to turn over information so they could steal your money. And there's been a lot of unemployment benefit scams all across the country where scammers inside the country and outside the country are posing as us and filing claims and hoping to be able to make claims in our names. So if you get anything in the mail from Department of Labor, whether it's a validation of a claim or a change of address letter, please report it directly to the Department of Labor. If you don't know how to do so, get in touch with us. We'll let you know how to report the fraud. The FTC has sent over 200 letters to companies who are advertising bogus cures or preventions for COVID, and that's not likely to let up anytime soon. Kentucky was warning about fake pop-up testing websites where they were trying to steal money or your insurance information in exchange for a fake COVID test. The state of Maryland issued a warning about charity scams. So there was a lot of scams that popped up to help, your health heroes or to help folks that had lost their jobs. This is a trying time and folks want to be providing money that's actually helping. So you definitely want to investigate the charity. If they are licensed with the Secretary of State as a charity, then you know that at least there is some oversight. So that's the first, at least you should do that. You can always check out GuideStar, Charity Navigator, and give.org and vet the charity before giving any money. There's a lot of fake websites that are out there, whether they're advertising Clorox or PPE. The FTC has been trying to shut them down, but they set up so easily. You may be finding things on Instagram or Facebook who are then trying to sell you something maybe through a Shopify storefront or maybe even not. These are brand new websites. vet the website, see how old it is. You can search how long it's been in business. And if it's less than a year old or less than 6 months old, search to see the word scam after the website name. You can do a Google search that says, you know, XYZ Inc. scam, and see if there's been a lot of complaints about undelivered goods, because that's been rampant. Job scams are huge right now. In the last week, I can't tell you how many fake interview emails that have come my way, anywhere from FedEx to being an insurance salesman and working from home, doing something completely random, like doing inspections for my house. And I'm not really sure how that could possibly be. So job scams are huge right now. The WSSC had issued an alert about these unnecessary water filters. Those are not the droplets that we're concerned about. And since you are home and they now know you are home, there was 54 billion spam phone calls made through robo-dialers in 2020. So you're not imagining it. Your phone really is ringing off the hook. And because we are home and we're trying to stay connected, especially seniors, the romance scams are on the rise. Folks are, it used to be you have to come up with an excuse why you can't meet in person. Now there is no excuse. And so these criminals are creating fake websites. They might try to reach you through, maybe you're playing Word Feud or Words with Friends or Scrabble or something online. They might find you on social media. There's lots of ways that they will try to find you and strike up this relationship, which always ends up, the goal is to get money from you. Next slide. So this is how folks can reach us. Definitely follow us on social media. We put at least 2 alerts out a day, whether it's a scam alert or some newsworthy piece of information about consumerism, whether it's Facebook or Twitter. We put 2 out a day. Instagram, maybe not as often, but we do put a lot of information there as well. And a lot of our webinars, so if you want to spend an hour learning about these scams, we have a webinar playlist on our YouTube channel that will go in detail about how to stay safe online, what kind of scams are out there, and about debt collection if that's an issue that's coming up. Spend some time on our YouTube page and you can learn some more. And if you need to reach us, that email is good. We have a phone number where you can leave a message for us and we'll call you back, or reach us through MC311. They can also find us. And unless there's any questions, I will pass this on to Patrick at Emergency Management.
All right. Thank you very much. My name is Patrick Fleming, and I'm with the Office of Emergency Management and Homeland Security. I'm one of our planners, and right now I'm taking lead on the community outreach. So Jim, you can go to the next slide. So I want to talk about some of the natural hazards that occur within the county and some things that you can do to be prepared. So the big things that we are concerned about here in the county are thunderstorms, winter storms, which can include snow, extreme heat, flooding, and tropical hurricanes and tropical storms. So next slide. So the big thing that we always hear about, there's a winter storm watch or a winter storm warning right these days, or wind warnings, or just the myriad of things that are happening. So it's kind of sometimes a little difficult to fully know the difference. So the difference is, this is easily explained by a meteorologist, and unfortunately for them, their attribution has been lost in time. But a watch is saying that all of the ingredients are there for something to occur. And then a warning means that it is going to, or it is there and it is happening. So it's like, think about, there's a winter storm watch. And so it just means that there could be winter weather, but a winter storm warning is that it is going to happen and it is going to be winter precipitation. You can go to the next slide. This is taken from the Ellicott City floods that occurred. I believe this picture was from the 2018 floods. So I always try to include this in outreach because it's a very good presentation of what happens during flooding, and that when on a roadway before this picture was taken, it just looked like there was roughly about an inch or so of water on the roadway. And if you were walking, you could fall into this. And if you were driving, you would drive your car into that ditch and hopefully you would be able to get out, but that may or may not actually occur. So as we say, when it comes to either standing or running water, the saying is turn around, don't drown. And so that's the important thing. Go to the next slide. Thank you. As we're getting ready to go into the summer months, we're going to be experiencing extreme heat. I know that it's hard to believe, as the county just issued an extreme cold weather or a hypothermia alert for this evening, but we will be there soon enough. And I, for one, am ready for warmer weather. But please make sure to listen to media, follow social media or the county's websites to see if we're doing opening cooling centers across the county. Make sure to wear hats and sunscreen, and consume. The most important thing is to consume water. So just hydrate, hydrate, hydrate. You can go to the next slide. The next things, the most important thing you can do is the first step in creating a plan is to stay informed. So sign up for alerts through Alert Montgomery. You can go to the county's website, which we'll put on the end of this because it's a little long. But if you just Google Alert Montgomery, it'll pop up and you can register very quickly. Also, make sure to pay attention to local media, so both television and weather. Jim, you can go to the next slide. The next thing is to make a plan, and that's important so that you can identify, so the important thing is to talk to at least 2 people in your support network that you can use that can be used as a resource, that you have somewhere to go in case something happens. And then also make sure that you're able to, that if you live with someone, that they also know the plan, and that you have plans in place to, as Jim Resnick pointed out earlier, that in case there's a fire, you exit your home and you know where you're going to meet at a designated location. And as Jim also pointed out in the files of life, that's a really important thing to have because it can list your medications, your insurance, just a myriad of things that you can have at a very easily. And if you need to leave your home, you're able to just grab that file and it has all the information in one place. You can go to the next slide, Jim. Thank you. Make sure to talk to everyone in your home about the plan. And be familiar with the emergency plans if you are in a multi-unit dwelling. So if you're in an apartment building or a condo, make sure that you know the exit routes that are appropriately designated. And then also, one thing that I always talk about is make sure you know where you can shut off. You can shut off your utilities. So if there is an earthquake, while not common in Maryland, they do actually happen. So just make sure that if there is an earthquake and you know where your gas line is and you're safely able to turn it off, please do so. Then you can go to the next slide. Reach out to your friends in your church or your community, your greater community, I should say, and develop a support network. So in case you need to go to a shelter or need a ride someplace. And the county's website, if you go to our website, which is Montgomery County, Maryland.gov/OEMHS, you can find a myriad of materials and plans that you can fill in with pencil and paper and go to, that has a lot of this information already on it. Jim, you can go to the next slide. I'm just going to keep going to the next slide. Yeah. And then one important thing to remember is that if you have a pet in your house, that you to take the needed steps to be able to have things for them. So make sure you have food for them. If they have any prescriptions, make sure you have that. And then also, simple things of making sure you have a leash that's available if you may need a portable crate to be able to take care of your animals. And then also a leash or a harness for them. Go to the next one. The final step is to make sure to have a kit at home. So when you're in your home, we talk about having a kit for at least 3 days worth of food and water. One thing I learned the other day talking about making sure you have the ability to quickly grab clothes and water. If in an emergency you need to quickly leave your home, tip I heard the other day was to grab your dirty clothes, because that way you at least you have seasonally appropriate and appropriately sized clothes for you. So you can always get them washed at a later date and time. But listed on here are some things to make sure you have in your home. Also to keep, if you have a vehicle, try and keep some of those things in your vehicle. But also the last thing I want to talk about is kind of a COVID kit to have. Make sure you always have your face covering, be it a cloth mask or some grade of medical mask, but also to have hand sanitizer with you, and make sure you have those items before you leave your house. Next, I'm going to turn this over to Myra Derbyshire to talk about some food access.
Just a quick point before Myra starts, please, for everyone who's on this Zoom meeting, we are recording this and we may use it for future use. Thank you.
Thanks, Jim. Thanks, Patrick. My name is Myra Derbyshire. I work with Patrick and Jim at the Montgomery County Office of Emergency Management and Homeland Security. I am part of the Food Security Task Force, and we just thought it would be important to let the attendees of this call make sure that you're familiar with what the county has done in reference to food security. The first thing is we have a food security page on our website, and I will put that in the chat after I'm done my presentation, so everyone will have the link that you can go to. And on this page, you'll find a calendar that has all of the food giveaway events throughout the entire county. You'll be able to see a food provider map, so you'll be able to see which providers are providing what food where for what populations on what days, and then you'll be able to see contact information. Some of them provide diapers, rental assistance, other case management activities. So you'll also be able to find information for children who are experiencing hunger through the public school system, SNAP information, which is formerly food stamps, and then WIC information, women, infant, and children. And then most importantly, you'll be able to find information for our senior nutrition program and also our meal delivery program, which is a program that we have started to be able to deliver prepared meals cooked fresh in a restaurant and delivered to people that are unable to either cook their own food or leave their homes, whether it's due to a physical disability or being in a senior living environment or being COVID positive. Next slide. So another great initiative that we have created is the Food Access Call Center. The Food Access Call Center is that one-stop shop for anyone that has any questions regarding any food or any questions related to hunger or food in the county. It's really, it's really easy. You can just dial 311 on your phone, or you can go online and submit a online self-referral form. And you can do this 24 hours, 7 days a week. So you can either refer yourself or someone else through this form. And the form is available in seven different languages. So English, Amharic, Chinese, French, Korean, Spanish, and Vietnamese. Next slide. So we just kind of wanted to wrap up and let the people on the call aware that there are a ton of volunteer opportunities in the county right now. So mainly for food insecurity, vaccinations, donations, and volunteer response. And then there's a specific link that I'll also put in the chat, so you can go directly to that, so you can take a look at all of the opportunities that are available countywide. And just real quick before we move to the next one, it's kind of hard to see, but in the picture, in the PowerPoint slide, you can see that was one of our actual food distributions that we served a couple thousand people that evening, both on foot and in their vehicles, and it was completely run by volunteers. So volunteers really are the heartbeat of providing food security for the county. So next slide. So any questions that you have for Patrick and I, here's our contact information. I'll also put this in the chat, and we're here to answer any questions.
think now we're going to turn over to Sean O'Donnell, probably for the main event about information from HHS.
Hi, everybody. Thank you for having us here. I'm with the Montgomery County Department of Health and Human Services. We've been working on your behalf over the last year to identify this disease that's come out, try to figure out where outbreaks are occurring, and try to reduce the spread of disease. We've stood up testing sites around the county. We've partnered with various health initiatives to expand those testing sites. We've distributed PPE to our health professionals and other folks who work on behalf of the county, including our food access folks that you just heard about. We've been trying to promote messages about how to protect folks. And then most recently, as of very late December, we began vaccination efforts across the county. So within those vaccination efforts, our goals are to develop widespread immunity through vaccinations. Immunity comes from either receiving a vaccination or from recovering from a disease. And we'd much prefer that people get vaccinated than have to go through COVID. As of at the end of December, we got a very small amount of vaccine. And then over the last few months, we've begun to get a little bit more as time has gone on. We still know there's a very limited amount of vaccine, not nearly as much as we wish there was, not nearly as much as we would like to distribute. And it's not just the health department distributing vaccine. We are in partnership with our fire rescue services, who provide a lot of vaccinators and expertise. We work very closely with our medical reserve corps. And one of the largest groups of individuals who have been supporting us is our school health services, which is part of HHS. So we've had a number of other agencies. The rec department have been fantastic partners, and the schools themselves. We've been doing vaccinations at some of our schools. We couldn't do this without all of the county coming together. On some days, we've done more than 4,000 vaccinations in a day. We are still only about 30% of the vaccinations occurring in the county. The other 2/3 of vaccinations are occurring through hospitals, through pharmacies, through some mass vaccination clinics, which currently are not located in the county, but are accessible to county people at Six Flags and at M&T Park. There's also something called the Pharmacy Partnership, which has been, since the beginning of vaccine availability, has been helping to vaccinate congregate living facilities, initially nursing homes, then assisted living, and now currently they're helping out with some independent living. Within the county efforts, we've stood up some vaccination sites and we've worked through the priority groups. It started with our healthcare and EMS and then began to include some of our public safety partners. As we went along and we got through a majority of that group, we started inviting out individuals who are 75 and older. These are the folks who are most at risk for serious consequences if they catch COVID. We wanted to make sure that we protect as much as possible the lives of our citizens. As we work through that group, we'll begin opening up to additional groups in the 1B category. Some of our essential workers who have high amounts of public contact and can be a point of spread to other individuals. We're going to continue to vaccinate those who are in the prior groups, including our 75 and above. We have lots of individuals who need second doses from that group, and we know there are still lots of individuals who need first doses. The way we're trying to get to individuals, especially if they fall into one of these priority categories by age, if they're 75 and above, soon if they're 65 and above, or if they have underlying medical conditions. How do we know where these individuals are? How do we know how to contact them? Well, the county has started what they call a pre-registration process. If you go to the county website, you'll see a banner as soon as you get to the county website that says, for more information on vaccines. When you go to that site, there's a big red button that says pre-register. If you've already pre-registered, that's great. We'll get to you as vaccine becomes available. If you haven't pre-registered and you believe you're in one of those age-related groups, you're 65 or above or 75 or above, you have an underlying health condition that you've read about, might get priority for vaccine, or you're one of those essential worker categories. All of those groups are listed on our website. It would probably take me the next 20 minutes to mention every one, but we recommend go to the website, click the pre-registration button, and it will take you a few minutes to fill out your information. You can have a family member or a friend help you with it. And if you need help registering and there isn't someone to help you with it, we'd ask that you call, and if someone can put this in the chat, that would be helpful. We ask that you call 240-777-2982. That's 240-777-2982. Thank you, Myra. And we have staff that are standing by. It's generally between 8 a.m. and 6 p.m., but it is 7 days a week, and they can help you get on that pre-registration list. Now, we have about 200,000 people on that list, which is approaching 20% of our county, because it includes a large number of people who are in all those categories. I can tell you right now, we have been getting a little more than 4,500 doses a week. The good news is we're not the only ones getting it. As I mentioned, it's coming into other areas. We do understand that each different person who offers a vaccine other than the county has their own way to sign up for it. I know that's frustrating. We have partnered with some hospitals and some places to share our pre-registration list so they can contact people from there rather than having to do a first come, first serve type of thing. And we're trying to increase that more and more to reduce that frustration. But if you want to know where else you can get vaccine, that is also on our webpage. We have a link for each of the providers in the county who offers vaccine. And we have links to some of those large mega sites that are outside of the county. We are trying to convince the state to send us more vaccine, whether it's at a large vaccination site or through other partners. We just found out yesterday the Johnson & Johnson vaccine has been approved. That's a single dose vaccine. The early reports are there are fewer side effects, but I can tell you the side effects for the other vaccines have not been very high from what we've seen. But with an additional vaccine approved, we hope that will increase the amount coming in. It's not, we can't order more. We rely on the amount allocated to the state, and then the state assigns it to the local health departments or to those other private partners. So again, we're waiting on the manufacturing to increase, and then the state to get that out to us. And then we'll continue to work through our groups. Again, if you're 75 and above and you've pre-registered, you should have gotten an email by now to make a vaccine appointment. We are going through, and we're going to go through the list again and offer more opportunities to get vaccinated. If you do not get an email and you believe you're on that list, and you do not get an email in the next 2 days, you may need to pre-register on the list to ensure that we have the right email for you. We do periodically send some messages out to make sure that we have your email correct. If you're not getting those messages, you may have to pre-register with an updated email. We also call individuals. We know not everybody uses email. If when you register, you indicate you don't routinely use email, we will call you and try to set up your appointment that way. It does take us a little bit longer to go through that, but we will commit resources to doing it. And then finally, we know there are people who need transportation support or who are homebound, and we are working on getting resources to get vaccine to those people or get transportation to those people. So if you indicated that you were not able to come to a clinic because you were homebound or you needed some support with transportation, please know we're working on it, and we will get you an appointment as soon as we can connect you with those resources. Finally, I just wanted to mention, we've done so far across the county, there's been 156,782 vaccinations that have occurred across the county. Roughly, and that's first dose. So that's 156,782 people who have been vaccinated at least once. Roughly half those folks have received the second dose already. We're continuing to work through it. That is about 15% of our population. We know we have a long ways to go. I do also want to mention that while we're vaccinating, since we're talking about safety, and this is what I tell my parents, you still have to wear a mask, you still need to socially distance, and you still need to use proper hand hygiene. If you've been vaccinated and you want to go out shopping, still wear the mask. If you have hand sanitizer, sanitize your hands afterwards. We're still trying to protect other people, and we're trying to protect you. We know there are some variants of the disease. We know that the vaccine offers some protection, but we want to stop the spread of not only the primary COVID, but the variants. And we've seen a drop off in other influenza related diseases because these practices work. So please continue doing the distancing, the hand washing or sanitizing, and wearing your mask. And so those were the main points I wanted to share with you. You've got a bunch of great advice from the other groups. And by the way, I noticed that Tracy used a bunch of public health terms and saying that describing the mutations and the hand washing. And I appreciate that. Anything to repeat our messages and get them taken home is appreciated. So if there are any questions, I'm also happy to entertain those.
That's great. Thank you. Jim McClelland, we're passing the microphone back to you, sir.
Okay. I have been watching the chat forum for questions, and most of them have been about how they can get additional information, whether it's for their community or for individuals. And the answers have been put out there, but bottom line is all of our departments have a community outreach component to them. And it's something we did before COVID. We had to kind of curtail that due to public gathering concerns, but there's still a way of reaching out to us either through MC311 or any of the email addresses that are listed in the chat forum. And we can get additional information to you. When it's safe to, we can resume outreach events to be able to speak to communities about general safety practices. So with that, one last call for any questions, and otherwise we're going to wrap this up. I want to thank everyone for taking the time to join us here on both sides, the presenters and the attendees. And again, reach out to any of us if you have any questions or need additional information. Thank you so much and have a great evening.